passed, which is that the fire department hope to get into doing more with ambulance services. I'm joined by my colleagues, Councilor Schultz, Councilor Gathers, Councilor Hogan, and Councilor Driscoll. And then, of course, we have the fire chief here in his team, and Budget Director Rudd. Is that Frank back there? Hey, Frank. Good morning. And then Brett O'Connor, Treasurer, of course, Commissioner of Finance. Before we get going, I think we should start with an overview. I think Chief Mann, we spoke yesterday as to how we can go. I don't know, Brad, are you going to take it first? Yeah, we want to start with overview, the problem, and I guess a working solution, right?
Yeah.
Before we have any questions. All right, go ahead, Brad.
Thank you, Councilor. Good morning, Councilors. Brad O'Connor, Commissioner of Finance. Thanks for taking the time to talk through this. This is obviously complicated, which is why it's taken a while. We quickly identified the problem, but it's not an easy solution. So that's why we're here today. So regarding the ambulance services in general, so the fire department has long had both the Department of Health certificate and the EMS operating certificate to provide emergency medical services and ambulance transport services. So that's not what we are requesting for approval today. What the department hasn't had is the budget to operate the ambulance services. It's a complicated service that requires personnel, equipment, maintenance, and it's never been included in the budget. Fire department is always looking for money to continue its operations. They've done really well at that, but this is an add-on to their budget that if it wasn't funded another way really would deter from the fire response that they're already providing and other emergency responses. So unlike neighboring municipalities, we are lucky because we have a private ambulance responder that serves our residents. Most neighboring municipalities don't, and so they're solely reliant on their own providers. Over the last couple of years, the primary providers had some difficulty fully responding to medical emergencies. And since May 2021, there were over 2,000 calls that have been dropped. And what that means, when a call is dropped, someone calls 911 and our primary ambulance responder says, we don't have the personnel, we don't have the equipment, we're already dispatched, we can't respond to that call. So that call then gets rerouted to other responders in the area. Most of them are suburban ambulance responders. So in case, it's going to add time to the response, which becomes really dangerous. The other thing that it's doing is it's putting a lot of stress on those suburban ambulance departments. These aren't large departments. Usually they'll have 2 or 3 ambulances and to come into Syracuse, drive to a hospital locally. It really puts a stress on their resources, and several of the town managers and mayors have reached out to us to let us know that that's a problem for them. In 2001, the mayor authorized the fire department to use existing funds for a pilot program to see what we could do if we re-engage these ambulance services. We do have some of the equipment that we need. We do have some of the certified personnel that we need. And so...
When was the pilot, Brad? Sorry, I missed that.
What was that?
When was the pilot?
Started in November 2021, okay. And it is ongoing. Through mid-January, the city responded to 200 calls. So those were 200 people that otherwise would have waited longer for a suburban response to come. These are all dropped calls that the city fire department picked up.
So Brad, that was procedurally the city fire department became the second, so they cut out the county and suburban fire
Right.
department part. So
Right.
we became the second call if somebody couldn't do the.
That's right. And my understanding is when the call is dropped, it goes out to everyone, and the first to raise their hand takes the call. Is that right?
Yeah, I'll let that get through, and then I'll just kind of go over that process.
Okay.
Crystal, how that occurs, because it's a little bit more, it's a little complicated. I just want to make sure you guys understand that.
Okay.
You'll have to talk a long time if it's that complicated with that.
I'll explain it pretty quickly, but trying to explain it right, explain to you guys.
Okay, thanks, Chief.
Smart. So through fiscal year 22, we're expecting to spend about $150,000 on this pilot. This isn't the full program that we hope to engage. This is just a part-time pilot. The services are expensive and growing. The need is growing. So I don't think this is something we can ignore. If we do, we're really putting our citizens in danger. Again, the fire department's budget is already constrained. They've got a lot to do with the resources that we're currently giving them, and to add something else to their plate would be difficult. As far as billing for these services, so all of the private providers and most of the municipalities that are responding do bill for these services. They bill insurance, and so before the fire department started this pilot, people were being billed and paying, or insurance was paying when they requested an ambulance. Usually the copay on these insurances are anywhere from $50 to $150, so that is the responsibility of the individual. And those are being billed to both the insurance company and the individual. These billing practices are difficult. There's a lot of rules around how we can bill for medical services, who we can bill. Each of the insurance providers has their own rules. Medicare, Medicaid has their own rules. That's not a business that we're in. It's probably not a business we want to get into because of the complexity. So what we would likely do if we were to bill for these services is we'd contract that out to a third-party medical biller, someone that's familiar with the laws around billing and procedures around billing. And we would largely rely on their expertise regarding billing. So the bills themselves attempt to cover the cost of the operation. What we're hearing from other municipalities is that that's not always the case. These operations are more expensive than we really can bill for. So they're telling us that it really only covers about 65 or 75% of the operation. That's probably something that we could expect, something in the same range, if we were to bill for these services.
Wait, sorry, I missed that. What it covers only covers 65, 70%?
The billings only cover about 65 or 75% of the actual cost of the operation. So the amount of the bill attempts to approximate the cost of the operation, but it's constrained by what insurance would pay and some other factors, and so usually that bill only gets up to about 60 or 70% of the full cost of the operation. So if you're looking at the full cost of the ambulance operation across the full year, and you compare that to what was brought in or what was billed, you're only covering about 60 to 75% of that cost.
Is that for regular ambulance services as well?
It is.
How's that a profitable model?
That I don't know. Really, we don't have the information from the private ambulances. This is from other municipalities that were willing to share the
I'm
information.
confused on that, because if it only covers 60% of your overhead, how do you sustain yourself? But I don't expect you to know the inner workings of how ambulance finance.
I don't.
works, but
I could try to find it out for you.
Is it of the overhead though, or is it kind of the funny money of our healthcare system where a service costs $2,000, but insurance will only pay $1,000, so therefore you only get paid $1,000?
What they're telling us is the actual listed bill amount only covers 60 to 75% of the total cost.
Then we'd have to somehow account for the billing service that we're gonna,
We would have to count for the billing service, and we would also have to subsidize the balance of the operation.
so it would be more than, the actual cost when you fold in the billing service would be more than, or less, more than 65%, less than 50%.
Not necessarily. I think, that total cost of the operation would include internal billing and other administrative support services. So in all likelihood, a third-party biller could do it more efficiently than we could do it internally. So I wouldn't expect the cost of that to go up by outsourcing it compared to how cheaply we could do it internally.
It's still a cost,
Yeah.
but
Yeah.
is it more of a cost than?
Right. So, one thing we've been talking about quite a bit, and we've heard some concerns from you, is hardships. We don't want to create a hardship for our residents, and I don't think that's what this is doing. This is a service that's already being paid for by the residents. We're not introducing a new cost. What we're trying to do is offset our expenses with revenues, and it's the similar or same revenues as the residents would be paying if someone else picked them up. We still, if this is fully operational, we would still only be able to respond to a small fraction of the demand. AMR would still be the primary provider. We would just be supplementing that. An AMR and any other suburban ambulance is going to be billing for these services. The extent of hardship cases, really, it's unknown. We don't know. We don't know the numbers of that. Who's riding in these ambulances? Who can afford to pay? Who has insurance? Who doesn't? So it's hard to really build a good solution without having that information. The other complexity is the regulations regarding billing. So there are state regulations, federal regulations. Each insurance provider has their own requirements. So we are trying to figure out what those are with regard to billing and any hardship. What we would probably want to do if this was passed is work with the third-party biller. They're going to have the expertise. They're going to have the attorneys that understand this because it's something they work in every day. So we would want to work with them to develop a right plan in case of hardship.
Who would be the third-party biller?
Don't know that. We would go out to bid.
Go out to bid.
Or RFP. So that would be our intent if this passed. The next step would be RFP for a medical biller, find the right medical biller, and at that point we can start to understand a little bit more about how we would be billing these and what we would be billing.
Just on that one point, just to be clear, I do think there's a preferred biller, so we would be waiving bid to use the one biller, and then we would be doing an RFP after for the
Who's
long
the
term.
preferred bidder? Biller.
The name of the company? I don't have the company's name memorized, but
We already got it set up, we wouldn't,
that's what's in there.
Sit down at the table if you understand.
Yeah, sure, come on.
come on, chief.
Come on, Chief.
We love having you at the table, Chief. Absolutely.
That tie is working it, Chief.
So I'm Michael Mons, I'm the fire chief. I think Brad explained a lot. I know you guys had some questions and I can answer whatever questions. Some of them Brad has been working on the financial situation. I just gotta open up my data. But as far as the third-party biller, since 2018, we've been looking at just what the options are. There's a local biller in Baldwinsville, they're called Multimed. They service pretty much most of the ambulance services in our area, all the way down to Norwich, pretty much all over they're one of the top medical billers in our state, in our area. The way it would work is based off of the percentages that we would recoup, they would get a percentage of it. But there are laws, like Brad was alluding to, HIPAA laws. There's a lot of privacy things that go into people's medical things, like as when you go to a hospital. So they're pretty much an expert at it. As Director Rudd was saying, our goal would be to possibly try to waive the RFP to get that in place and then put it out for an RFP once we get things going, so it can go through the regular process. Do you have any more questions regarding the third-party biller?
And just on that is the context of a pilot again. I guess like waiving it helps us to get it up and running, to build, to see if that helps support it. And then if we decide this is a service to provide in the long run, that's when we would do a longer agreement to have a medical biller.
So we'd have like a RFP all set up, and then we'd have another RFP if we decided to go ahead with this as a pilot project. Right?
I would imagine we would ask for a waiver initially because we're responding to alarms right now, to have a waiver to get them on board right now. So if, with your approval, if this legislation gets passed, we can start recouping money. And however the waiver lasts, is it a year that lasts for, Tim? Pretty much, we would ask to do it for a year, and then after that time frame is we would put it out for RFP and make it an open competition based on our parameters and our criteria, like all the rest of the RFP processes. That's what we would try to do.
They'd probably win it, I bet you.
I mean, yes, the fact that we give a company the award initially during a pilot certainly gives them an advantage. We're not pretending it doesn't, but given the context of running an emergency pilot, and billing helps us sustain the pilot. So we burn through the money we have set aside for the pilot faster if we don't bill, and it'll take us much longer to do an RFP process that would have a lot of uncertainty, so we might not be getting great prices. So there is a trade-off, but we're definitely aware of that.
So just to be clear a little bit in terms of numbers here. So here, basic life support is $1,000, right? And I think if I'm understanding correctly, basic life support costs $1,000, right? We get 60% of that, right?
Depending on how the third-party biller is able to recoup.
Okay,
yes.
okay. So this $1,000, we are hoping, right, approximately, that 40% of this, which is $400, is going to third party. So the city would be getting 600. Assume that that's the case. Is that correct?
I would say that you're talking about one specific call.
Right, just one, yeah.
We're talking about 60% would be 60% of the patients that we deal with. We're assuming that we would recoup 60% of the alarms we respond to, 60% of those alarms out of 100%, we would be able to recoup some type of money. The $1,000 is what the industry standard is on a basic life support call.
Right.
So
right, and what I'm saying is, assume that, like you said, pilot last year, there were 200 calls, right? Out of that 200 call, just assume that each of those 200 calls that came to us, each one cost $1,000, right? Assume that, right? Which is $1,000 times 200. What is that?
$200,000.
200,000, right? Out of that 200,000, are we saying that 60% of that 200,000 potentially could be what's coming to the city?
No, really when we talk about 60 to 75% of what we bill, what that means is we bill, say, $1,000, that service probably costs us closer to $1,500. So we're not actually billing the full cost of the service. So that's really the difference. We're expecting to collect a lot more than the 60%. And I don't know the exact collection rate, but I typically with insurance companies, the collection rate is fairly high. But that being said, the 200 calls, we wouldn't necessarily bill for 200 calls, because 200 calls would include responses where the patient refused service. So, that's a cost to us that we can't bill for.
So wouldn't you bill for the 1,500, expecting only to get reimbursed 65% of that? Therefore, 1,000, go ahead.
Just to add to the cacophony, Frank Oliva, the city's chief administrative officer. Yes, but. And the but is that in order to bill insurance, you have to be a participating vendor, so they tell you. We give them, this is our normal fee, and they'll say, great, this is what we're actually going to pay you.
Right.
So the service costs us $1,500 because of the overhead, but Excella says, we're paying you $1,000, bill us $1,000. We don't want to see that other difference. That's why we bill. That's why there's so many moving parts here. That's why we need the third-party vendor to do the billing.
Other questions? You want to continue, Chief?
I'll just say, Councilor Hogan, you were asking about our response and where we fall. So, the billing component, what Frank and Brad are talking about, and what we just had the questions is one component. The real reason we're here even talking about that is because the crisis we're in, that our people in the city are facing because of what Brad termed and what I'll term as drop calls. So just to be clear, a drop call, when somebody in the city calls 911, we have our firefighters that are on duty 24/7, 365. They're all certified as basic life support first responders. They don't transport. Their job, when the 911, somebody in the city calls 911, it goes to the dispatch center up at Onondaga County. A critical call, we'll send one of our fire trucks, our pickup trucks, we call them minis. They go to the call first, and their job solely is to go identify what's going on, provide stabilization to the patient. If there's any critical life threats, they try to stop that immediately. It's a tiered system. The second part of the tiered system is having an ambulance come to transport once our BLS providers are on scene, which is typically, like Brad said, is a private ambulance company. So when the 911 call comes in, the 911 center who dispatches the fire department, they get the call, and their system is integrated with the private company, which is AMR at this time. They get the call at the same time. If the private ambulance company within 3 minutes doesn't dispatch the ambulance at the time, they have an additional 5 minutes to try to find one of their resources to send to the alarm. Or they can call the dispatch center and say, you know what, we don't have an ambulance. At that point, they need to ask for, we can call it mutual aid, even though it's no formal process, but another ambulance service in the county will come if they're available. And they're coming from Liverpool, North Syracuse, Baldwinsville, Fayetteville, Manlius, East Syracuse. They're coming from everywhere outside of the city. Sometimes, if we're lucky, they'll be in the middle of transporting a patient to the hospital, and as they're clearing one of our local hospitals in the city, they might get the call right then. So just based off of those, that criteria, and that's the process on how calls come into the 911 center. When the private ambulance company right off the bat can't determine or figure out to send one of their ambulances, we consider that a drop call, and then that goes out to the county. What we realized was, since 2017, and I'll just do a little bit of data diving, just so you guys are clear about the need. The billing is one part, that the need is that we have people that are calling 911 that we are, you guys are elected, constituents of. I'm in charge of trying to help protect, their public safety. So since 2017.
Who compiled this data?
We compiled it through the 911 center based off of our records management system. AMR has their own dispatch system. It's proprietary information that they have. But our relationship with AMR, they've been serving our city since the 50s. We have a good relationship. We work on scenes together. The problem is the amount of 911 calls that come into our city, there's not enough ambulances. And then when you throw in the pandemic, there's a crisis going on, just not in our city. I had a meeting with fire chiefs from all over the state 2 days ago. This is going on in cities all over the state, small towns and villages. there's just an ambulance crisis, right? There's a shortage of employees, the turnaround at the hospitals, ambulances go, there weren't enough employees at the hospital to receive the patient, so the ambulance were stuck at the hospital, which when other calls come in, they couldn't clear because they have to maintain patient care. So there's a lot of things going on, and AMR and all the different, there's 16 other ambulance providers in the county besides our fire department. Everybody's trying their best, but the bottom line is there's not enough ambulances in our system in the county to cover all the 911 calls. And I'll be crystal clear, our city is the major strain on the county's problem. We have the highest population, we have a dense areas of density. We all know our demographics. So we're putting a strain on the whole county system because when these drop calls come in, Fayetteville and Manlius, their taxpayers are paying for their ambulance. And because, there's nobody that can respond, they're leaving their jurisdictions coming in, and their area is becoming unprotected. So our goal was just to help AMR and to support them and provide a gap coverage during this. And that was the beginning of this pilot program. But since 2017 up until March 16th of this year, there's been 5,150 calls dropped in the city, which kind of, that goes to about 1,031 calls a year. That's been about 63 months over that time frame. That's approximately 82 times a month that somebody in the city calls 911 in an ambulance that isn't coming because of this crisis we're in. And if you really break it down, it's almost 3 times a day, every 8 hours, somebody calls 911 for an ambulance transport, and there's no ambulance coming. So based off that data, we realized to what Brad was saying, January 1st of 2021 all the way up until March 16th, there has been 2,567 drop calls. We started that pilot program in November of 2021, November 7th. We've responded to 331 of those calls. So we're just part of the solution, but there's this problem going around in our backyard in our city, and AMR, and I've talked to the director of the private company, and he was thankful that we were trying to help supplement some of this. FEMA sent in a few ambulances to help out I'm sure you saw that. They sent in a few ambulances, but they weren't responsible for 911 calls. And really, that's my primary job. I want to make sure people's 911 calls are getting answered. One, so the patient can get the treatment they need and go to the hospital as soon as they can. But the second part of that is our many basic responses that I was telling you about, they're on scene stabilizing the patient. And not only is the patient being delayed, but our firefighters are out of service providing patient care. And if a fire comes on in their area, now that area is not covered with their fire protection. So there's a lot of things going on, but we're just trying to ask for this legislation to hopefully continue to have this pilot program to fill the gaps in for the private company. And my goal is to have the privatized ambulance take all these calls, and we could focus on our first response, our BLS, our stabilizing patients, and then have the tiered system where they can come and provide the service. So we did the pilot program, and this is just the data from November to beginning of March. These are our responses, and I'll pass these around. These are all the areas where we went to during this few-month program. It's in everybody's neighborhood. It's in somebody you might know was on one of these calls or whatever, and so that's the neighborhood. And these are the census tracts that just during our pilot program that we were able to respond to help relieve some of the stress on the system.
For these drop calls that you picked up, is that what you're saying?
Yes, when we went in service, what happened with the 911 call, the 911 center knew, so what we did is we put 2 firefighters, one was a paramedic, one was an EMT, we put them in service on top of our regular firefighting force. Their sole mission, they weren't to go to any fires, and I wouldn't even allow them to put on any firefighting gear. Their job was just to supplement the ambulance companies in the city, the privatized company, AMR, and everybody else. And we just responded to all the calls in the city. So they only responded, what was your question again? Sorry.
Forgot.
But those just drop calls.
Oh,
that you
yeah.
picked up.
So what happened was when we went into service, so this pilot program was put into place. We got data of when the most drop calls were dropped, and we realized it was from Sunday through Thursday from 3 to 11. So that's when we, with Director Rudd and Frank Kaliva, we got the money together and we put the pilot program in place during those critical high peak times, and they only responded to 911 calls. As I explained how the 911 calls come in, when we were in service, the dispatcher knew, so they first they sent our mini truck, and then they queried to see if AMR had somebody available, but they also knew that we had an ambulance that was in service. If our ambulance was closer, they would just send our ambulance. Our response times are under 4 minutes on most of these calls, or approximately all these red dots. We were dispatched from the time the call came in. Within 4 minutes, we were on scene providing care. And as you all know, our fire response and our EMS response is the best in the county. Typically, we respond to people's 911 calls within 3 minutes, most times. So that's how this pilot program operated, and this is the data that we put together. So the billing, right? The billing is just going to help pay for the manpower that we're putting on these ambulance calls. There's fuel, there's wear and tear of the ambulance, there's drugs that need to be paid for. Right now, historically, we've just been paying for that, and as the crisis increased, we don't have it in our budget, and so we feel like we want to provide the service the best we can until the crisis ends, until AMR can answer all the calls. And we know it's not a perfect system, and it's not a perfect system anywhere in the state or the country, but like I said, it's happening to our constituents in our backyard, and we have the capability to help, and that's all this billing will do. It'll come back and help supplement our service.
Councilman Majorca, if I may ask, Chief, I'd like to say once again, I commend you, the chiefs in the building, and everybody with the fire department. The operations part is very clear. I mean, I can't, say as a constituent to those in the city of Syracuse that I could say no to not, allow them to be available to receive an ambulance service, within the 3 minutes. People that work in the city that know the streets, that can respond and go places. That whole operations thing there is pretty much clear, and I might be able to speak for all of us here. However, the only thing that needs to really, really, really be worked on and cleared and present is just the billing aspect of the things. Other than that, I commend you guys. I'm so happy that the pilot program was able to be a great success. I mean, to be able to respond to these calls and all these drop calls and everything like that, I wasn't aware of that. You know what I mean? It was kind of weird to me not too long ago to see, Novak and all these other people. I'm like, I don't even know who those people are. Like, where do they come from, outside of AMR? And I'm glad that you made a very clear point that it's not that you're, overtaking AMR in any way, shape, or form because you don't have the true manpower to do so. You know what I mean? You just want to be, a secondary, first-hand response to those guys, which you guys have been doing. It makes clear sense, makes perfect sense. So I'm in agreement with it. I just need that budget part, the finance part, that needs to be worked out, because I got to be able to find out how you're going to receive revenue on this, and also how we're going to bill the citizens here in Syracuse.
Thank you.
Other questions? Oh, you want to?
No, I was just saying thanks.
I would just say, I just want to say to my fellow counselors, we're kind of, when you're talking in a council meeting, you kind of might not get the sense of the reality of it, but I had a neighbor who was one of those drop calls who had a heart attack, and the response time was, I think, over 8 or 9 minutes, and in that time he passed away with a friend that was there. So I don't know, I would just say, this is, to the chief's point, our constituents, when you talk about 2,000 drop calls, that's people that, it's life or death for a lot of these people. And I get some of the counselors' concerns that have been voiced about extra billing. But I mean, that's not uncommon. We do it with DPW. If someone wants to put out 12 mattresses, you pay for DPW services in your taxes, but when they want to do something extra, something special, we bill the citizens. We do the same with SPD. When there's extra services, you get free policing for your taxes, but if you want to do something above and beyond the normal, get a certain event patrolled or something, you have to pay extra. And this is a service that obviously we've got a gap in the system here that's costing lives, and
who better to do it than our, you know,
Men and women at the fire department.
yeah, the fire department. We are blessed in Syracuse to have one of the best fire departments in the country. You guys have the great response time. The data speaks for itself. So I'm just a huge, you know, Chief knows I've called him about this a couple of years ago. We've been talking about it for time about, you know, for me, this is a very, because of my neighbor that passed, this has been a personal issue for me for a long time, and I just want to voice my strong support for this program, and I hope my fellow counselors will consider pushing it forward, because we got to do better with our response times, and who better than the fire department in Syracuse, because you guys do a great job. So
Thank you.
I'm a huge advocate for this legislation. That's all I wanted to say.
Absolutely.
I have another question.
Yes.
So do you have all the equipment you need right now? Like, you keep referring to ambulances, but then earlier you talked about the mini trucks. Are they the same?
So, you know, there's, in our capital plan, the ambulances are, purchased every, depending on the wear and tear. Right now, we're just buying things as we're needed. We do have a plan. We could have all the data of all the things we definitely need. It's one of those things, we're just taking care of the problem and paying for it as we can. And they, through existence funds, they're helping pay for the manpower. But we definitely, the hope is that the billing is going to go right back into the service, so we can provide the service. It's not to make any profit. It's not to, we're talking about the billing part, is to actually put back into the service so we can buy all the different things that we can and supplement it maybe with our budget, depending on, but like Brad and Frank were saying, this money isn't in our budget to do to this extent to cover all these missed calls.
So how many ambulances do you have?
Right now, we have 2.
They needing more or wanting more?
The goal would be to have the system, the crisis end, and we always want to have the ability to provide a transport just in case there is no ambulances. There's been times when there's a large car accident on the throughway, and all the ambulances from our city have to go out there, and there's been times when I've called in people to man both of our ambulances to provide the system. Once you lose that ability, you know, and it's going to be on us on what are we going to do, and when we need it, it's going to be too late to sit down and have these discussions. Having this stuff in place is going to prepare us if that ever comes to a point where we have to do more. But my goal is to have the private ambulance do more, to do it all. And to be honest with you, that would be the goal. I think that's all of our goal, is to support them while there's this gap with this crisis, to fill the gap and help pay for it through the legislation that's in front of you.
I got one question as well. I don't really know about this, and hopefully you can. I got some general knowledge to a certain degree. How typically or roughly, how long does it take to clear a call? Once you arrive on scene, you then make that transport over to the hospital, and then it's just a drop off, fill out some paperwork, and then you're back out. Or
I'll let Chief Kane answer that.
Okay.
He's been a paramedic for a long time. And Chief Kane's he's a supervisor of our EMS division that oversees our ambulance also.
Okay.
Morning, John Kane, Deputy Chief. So generally speaking, in the past, you'd pick up a patient at their house, transport them to the hospital. You'd probably be in and out of the ER in about 30 minutes. It's turning the patient over, restocking your ambulance, completing some paperwork. With the nursing shortage that's occurred over the past year or more, which is actually part of the problem, we're finding that our crews, AMR crews, and everyone else are typically waiting at the hospital for about an hour. On a really bad night, it could be up to 2 hours, and that's what causes that cascade effect, where all the ambulances are piled up at the hospital waiting to turn their patient over, and now calls aren't getting answered. Mm-hmm. So that's really kind of where we fit in. And our ambulance is actually, even in the limited schedule we put it in, responds to about 95 calls a month as of right now. So,
thank you, sir. Appreciate that.
So you said you.
No, I'm so necessarily, I mean, as far as data goes, I mean, the chief mentioned increased calls to 911. That, the data would show that, right? Because I think we should share all the data that you've shared maybe around. You know,
Okay.
increased calls to 911 over the last, but obviously if the ambulances are waiting at the hospital, they're not out, it might not show the differential as drastic as you're mentioning, as far as calls go.
Well, my data was the calls that just weren't able to be responded by the primary.
So the total amount of calls is about the same or not?
It's typically from when I first started looking at the data in 2017. I have all that information. It's typically, if you give me a second,
I mean, Chief, based on what you gave and what Chief Kane has gave it, you guys are not far at all. You said it was based on the numbers in the last 5 years. You said it come to about 1,031 a year.
Yep.
Which, when you calculate that, it come to 82 a month. And Chief Kane just say 90, 95. So it's
Our
not-
average is
during our
currently
pilot
95.
program.
Right.
That's what we've covered. But
I'm
there's
talking about total calls.
Yeah, yep. In 2021, there was approximately 40,000 911 calls of requests for an ambulance transport that possibly could have turned into ambulance transports. Back in 2017, it was like 37,000. So somewhere between 37,000 and 40,000 calls a year. That's pretty much how many times people in the city, whether you're a resident, a visitor, somebody passing through on 81, they're calling 911 because a medical emergency is occurring and they think they need an ambulance. So 40,000 happened last year.
Okay, so it's sort of the same, the total calls, but what
Pretty much.
what I said about Deputy Chief King here is that the ambulances are locked up at the hospital waiting an hour. They're not able to answer any of the calls.
Yes.
So therefore, that's where the discrepancy in drop calls could be, correct?
Yes.
That's a big component, sir, yes. And I think another issue is staffing. Here locally and throughout the country, people just aren't applying for paramedic jobs anymore. So there's a staffing shortage as well. So in addition to the crisis where they're waiting at the hospital to turn the patient over, they also have fewer crews on the road to answer those incoming calls because they just don't have as many employees. So it's...
So typically those rigs that are locked up at the hospital are the primary, and you guys come in on the secondary end.
That's correct. When we do put our ambulance in service at Station 12, Ambulance 4, even if there's other AMR rigs in the system that are available, if we're the closest available unit, we go.
Good.
If there's no other AMR rigs in the system because they're tied up, we're going before any county unit would come into the city. But even with us putting an ambulance in, we have all the data, it's still mitigating just part of the problem. There's still times when the county has to come in and cover because AMR has no rigs and Syracuse Fire doesn't have their ambulance in service, or we're tied up. So it's a significant problem. You know.
How big is that gap, if you don't mind me asking? So like, you know, do we have the data on, so there's so many numbers being dropped, Syracuse Fire Department fills part of that gap. How wide is the gap still left, and you know, how can we potentially fill that, I guess I'm wondering.
We can tell based off those 5,000 calls that we talked about over the last 5 years, we know how many calls our ambulance went on, and then the difference would be the county ambulances coming in, whether it's the fire department in Manlius or Fayetteville, whether it's those other Waves or Eves. If we're not going, there's been a couple times where we know for a fact that when an ambulance in Oswego was dispatched to Eastwood, which that's what we're trying to avoid if we could put something in service. But so we can get that data. I don't specifically have those numbers, but
Right, that's probably not in your,
yeah, the overall drop call, and then we can figure out how many calls we've responded to. The difference is how many, that would be the number that the county ambulances have responded to in the city.
Gotcha.
If that makes sense, Councilor Hogan, I'm not sure.
Well, I mean, some of those companies outside the city, some of them are private, some of them are, what are like the mine,
Two of them are municipalities, the rest of them are nonprofits,
Okay.
and the other ones are private, right? I believe that's the makeup
so there's a
of it.
mixture of it.
Yep.
Right, and if you look, going back as far as May, which is the most extensive data set we have, when we really start noticing a problem, AMR is dropping an average of 200 calls per month. Their highest month was September, where they actually spiked up to 462. And we are averaging about 95 calls a month that we're taking. So we're meeting some of the need, not all of it. Our busiest month was January of this year, where we responded to a little over 140, but we're generally in the 70 to 90 range. But again, we're in service 3 to 11, Sunday through Thursday, so the drop calls that come in, you know, at 2 a.m. on a Friday, we're not in the game because we don't have our ambulance in service. So it is an around-the-clock problem. We put our ambulance in during the times that we viewed as being really bad.
And that would continue? Be 11 or be around the clock?
I guess that'd be up for, we'd have to review some more data.
There's no doubt in my mind, if anything we give the fire department, they're gonna do it, they're gonna be outstanding in it because of the professionalism there. So but I'm just trying to find out, as far as transparency goes, because we're elected officials, is this gonna, how much is this gonna cost the city taxpayer to have this extra service?
Well, I mean, do you have the most recent dollar amounts of what we've spent so far on this? We can give you the most recent data that we had for the 3 to 11.
Well,
And
this
they-
4-month pilot program that
Yeah.
you mentioned, remind me how much that cost us, Frank?
We're anticipating about $150,000.
And that was, what do we use funding for that? ARPA funding or what?
We have been using, we're probably gonna ask for ARPA funding from the money that's been allotted to the fire department.
So this hasn't come before the council
We're
before?
not, we're using the fire budget. We're just using the existing fire budget right now,
So you're using the fire department budget to fund the pilot
which
program?
is a big concern.
Okay.
So, and Council, I will say, you know, as you've heard, it's a countywide problem. There's still a gap of 105 calls per month. I will tell you that the mayor of Fayetteville knows this to the minute, and the decimal point. They're really.
You know the city of Syracuse taxpayers are county taxpayers too, correct?
He understand, yeah, but this is costing his village, and he's responding, Fayetteville is responding a lot, and they're concerned. So the fire chiefs have all been talking, but now the elected officials in the suburban areas are starting to have conversations as well, because this is as the chief, I think, has articulated very well, this is not just a city of Syracuse problem, although we're the bulk of the numbers. Everybody's experiencing the same problem. So this pilot is going to continue to be a pilot. It's not the answer. It's a finger in the dike. We're going to have to come up with a county-wide solution to this if AMR or the other privates can't come up with a solution themselves. The municipalities are going to have to do it.
And I'd like to add, I mean, when we put our pilot program together, we talked to Troy Hogue. We explained to his operations manager what we're doing to try to supplement it. And on December 7th, he called me and thanked me because there's this crisis going on.
And who's he?
He oversees AMR, and we've been in contact with the fire chiefs in Manlius, who they're like we're talking about, like what Frank said, they're paying for this ambulance to take care of Fayetteville residents, but when there's these drop calls and the fire department can't answer because of budget constraints or what have you, they're leaving their village and they're coming, however far that is, to come to a 911 call, whether it's in your neighborhood or wherever. They're coming, and the goal is just there's this crisis going on statewide, nationwide, but our city is the strain. Like, we're the strain, and everybody else has been chipping in, helping, and we haven't been doing enough. Plain and simple, the fire department has not been doing enough.
Just Tim Rudd, budget director. One of the hats I wear as budget director is procurement director, and one piece of the context that hasn't really been brought up is that we don't have a contract with AMR, right? So they serve our community, and we haven't had that. So one of the things we have thought about at various times is to do some sort of RFP for an exclusive provider. There was a time, once upon a time, where providers such as AMR actually made payments to cities for the rights. They don't really do that anymore because of some of the pressures economically on doing the service. But that is still, I think, something we think of. Should we have, like, put a call for proposals out to see who would respond, which there's a few ambulance providers, but it would likely be AMR since they're the biggest. And in that process, we could essentially set up a system of accountability where we could hold them to a standard that right now we don't have. So there's a lot of numbers that Chief Mons has that he does a really great job in. And at first, I didn't understand the significance of all of them. And then it starts to make sense when they all fit together. So in these RFPs, you're often having a threshold of I think it's typically like 95%. You would say, we want you to respond to 95% of the calls. So, which if you do the math on that, like 1,000 a year out of 40,000, that's like 2.5% unanswered. So I know each one of those calls is somebody's neighbor who may have a catastrophic ending, but the systems are set up to, if you were to cover 100% of calls, it would be a much more expensive system. So they're kind of making this trade-off decision around 95%. So I think traditionally they had been around that 2.5%, 1,000 a year, but then when it switches to 1,000 dropped in a quarter, that's like you've gone from 2.5% to like 10%. So I think he's rightfully saying like, hey, this is actually at crisis level. That's where if we had a contract, we would be saying, hey, what's going on? You drop below our agreement, but we don't, so we're not having that conversation. And then it gets really complicated for how the ambulance providers are. They would likely say, well, there's all these other reasons beyond our control for why our typical standard of service was not able to be met, including all the staffing things that I think as running this. So I definitely think this pilot in the near term is addressing this emergency situation caused by a whole bunch of things. And I think it may actually, in the fire department's been really, I'd say, responsive to using the data to allocate their limited resources in the most effective way. So by doing the things Chief Mons was talking about, doing it in the evening, doing it on essentially the weekend days, maximizes the calls they're able to respond in those hours. And they've certainly responded to more per shift than I would have thought they could have done. So it's all great. And I think that their impact may be that thing that kind of pushes us back above that 95% response. So even though they're not getting them all, they're getting a critical threshold that is right around that definition of success. So that's where, I mean, the long term, that's where I think we're going to learn a lot from the pilot and then be able to be in a better position to, one, articulate what the standard should be in the city to hold to account should somebody actually get that type of contract. And if nobody can provide the level of service, then we have better data to inform whether we should be providing the service.
So with that, Chief, as you assume that we were to pass this, what would you need in addition to the 2 ambulance?
I think we would have to look at our data for the calls based on the mix of calls we're responding to and just be able to purchase the drugs that we think we need on those calls, being able to pay for fuel, being able to have a replacement program for our ambulance. We only have 2, but just to have an ambulance that's ready to go if needed and when needed.
So would the idea be, since how many fire department do you have again?
We have 9 engine companies who, yep.
Okay, so with 2, that would the idea would be to maybe have at least half of the fire station. So assume like you probably want about 5.
The model we're working on now, this pilot program is in addition to our firefighters on duty. Their primary goal is to provide that BLS first response and fire response. I'd rather not task them with having ambulance transports based off of what Chief Kane says, because if they get tied up at a hospital, if the Bellevue Ave fire station gets tied up at a hospital and there's a fire on Elmwood, there's only 2 people coming, and based off the standard, they can't even go in and rescue anybody. So we want to keep our fire stations whole and put this in addition to what we already have in place. That would be the easiest, simplest, and it would mirror what we're doing right now. And we would just try to expand that based off the gap of calls that aren't being answered, that are being dropped right now. And I'd like to say, AMR, there's 15, 16 other services in the county. I know everybody's trying their hardest. I mean, these EMTs and paramedics, I just want to thank all of them publicly because it's a tough job. I mean, during this pandemic, everybody's telling everybody stay 6 feet apart, and they're going and getting in everybody's faces. People are sick and hurting. They're tested positive. Before the ambulance providers get there, they're being told on the way there's a positive case of COVID here. And I mean, this is a tough job, you know, and AMR to all the volunteer ambulances all the ambulances in the county, all the other people that are providing this service, my hat's off to them. And we're just trying to help out. We're just trying to get as many 911 calls answered as possible, so there's not a situation like Councilor Driscoll and I were dealing with last year. And like Chief,
and I think Dan Romeo, Councilor, I get that, Chip. I'm just trying to understand, you know, in terms of the making these happen, what would it require us?
Yeah, Councilor, I think Chief Mons has said it really well, so I'll just reiterate what he says. The city doesn't intend to expand the pilot on a larger scale at this point. Right now, this is a stopgap measure. We're asking for permission to bill to offset some of the expenses for that stopgap. The long-term solution, if it isn't the private, if the private provider can't get it together, if we decide that the contract with the city isn't the way to go, those, as the budget director said, that many cities used to go that route. It doesn't seem to be working anymore. This is probably a county-wide program. It's not Syracuse Fire expanding much beyond the pilot. It's probably the municipalities getting together and responding to it as a group. So I don't see the city going much beyond 2 or 3 ambulances and the kind of service we're providing. I don't think we can afford to do that.
Okay.
It would have to be banding together with other municipalities.
Okay, and how many personnel do you place to kind of
So right
do
now,
the ambulance?
right now we have, the budgeted spots, and Chief Kane has been overseeing it. I think we have 80 of our providers that have signed up to provide this service when it's in service from Sunday through Thursday.
Okay.
We have pretty much,
Yeah.
John knows the numbers of our paramedics and EMTs, but
How many would we have?
So every ambulance, in order for it to be ALS, Advanced Life Support, which is what we always do, has to have 1 paramedic on board and then an EMT. So we have 26 paramedics total in our ranks, and we have well over 200 EMTs. So staffing-wise, we're very well positioned to do this. I would say we probably have more paramedics and EMTs than any other agency in this region.
So there wouldn't be any cost other than what we are already, to the personnel, other than what we are already compensating them on, right? That's
At this
not-
point, we don't have the need to develop new paramedics, if that's what you're asking. I think we have enough. We actually have 2 that are currently in the fire academy right now, so our numbers will increase.
Okay.
But I would say at this point, we have more paramedics than in any other time in our history.
Okay.
But one of the issues is the burnout, right? Like, it's part of the national shortage of paramedics. So at some point, if this crisis doesn't come to an end, we have to do something more to supplement our paramedics. We 30 is good, but they've been running this pilot program, and there's only 30 of them running these shifts. And so I'm worried that at some point we're going to have to get some other relief or some more people trained in this manner. And we've been discussing with some internal training to get more paramedics as needed. But like I said, my hope is this crisis comes to an end and we just provide our first response, and then the private ambulance comes and takes care of most of the transports, and we can step back.
So just so I'm clear, so if we pass this, Frank, it's all set up to start billing city residents or not?
Well, so.
Because it says a schedule of fees and all that.
Responsible for a copay the same way they would be with any other service.
Who's that?
City residents would be responsible, if they're insured, for a copay the same as they are with any other service. What we will bill is the insurance. The third-party biller will manage. They will bill the patient's insurance first, and then if we need to, they will bill a resident as well for any copay.
So will the other legislation, we'll have to go through other legislation to hire the third-party bit?
Yes, as the budget director said, we'll do it on a waiver first, and then.
So that'll hit after this.
Correct. Right now, we're not authorized to do that.
Right.
So we need.
Once we authorize, we'll hire everybody's set up.
Those are the steps in order, yes.
And then once we're ready to bill, we're an ambulance just like AMR and everybody else.
And then the people who are served will get a bill from this third-party biller that won't, for services rendered by the city fire department, Syracuse Fire
For the
Department.
copay, yep.
So
But it'll just be an ambulance, though. Yes, it's the name, it's a city fire department. I guess it implies you're already paying the taxes for them, but they're gonna put on an ambulance hat. We're an ambulance here.
Thank you for clarifying
Sorry.
that. You probably won't get any phone calls from those Northsiders
They
at
will,
all.
and I'll just explain to them.
Sure, I knew, yes, you'll get used to explaining it to them, I'll tell you.
And just to be clear, if we don't go, somebody else is going and providing a bill to them. We're just trying to make response times shorter. So it's either they're gonna get a bill 20 minutes later because of delayed response, or we're gonna be able to have this program in place and get there 5 minutes closer to provide a life safety mechanism if we need to, and they're still gonna get a bill whether or not, we're the only ambulance in it that doesn't bill right now. So I just wanted to make that clear, that they're already getting bills when we're not going, and the goal isn't to do that. The goal is to be able to use this billing money to put it back into the people that are providing the service. So when the next call comes in, if there's this gap, we can provide the service. It's not to jeopardize marginal people in our community that, you know, might have an issue, or some people that might call you. It's so when they having a life safety issue, Councilor Hogan, when they call 911 and one of their family members is having a heart attack, if we're in service, and like Director Rudd said, it's not going to ever be perfect, but if we can respond and get there in time and save their life, and they get a bill afterwards, that's the goal. That's our goal. To have a delayed response and they not make it, and then they get a bill afterwards, the bill doesn't matter if they're not around.
Chief,
That's all I'm saying.
God bless you.
Okay.
But I mean, what I'm saying is they're getting a bill from the city fire department that they pay taxes for, and all that stuff you just mentioned, I agree with.
But you got to balance
this is something
this
different.
low response, though,
We'll
Councilor.
do all
That's-
the balancing.
Okay,
You know?
That's all. We're just trying to figure it out. And, you know, this is a touchy topic. If I didn't feel like, I don't want to come in front of you and, you know, go back and forth with you, but I'm doing it for the people that are calling that aren't getting a call. I'm not doing it for us. I'm not doing it to put this in service. It's so these people that call 911 get a response if we could help. That's the only reason we're doing it, for the
Chief,
people.
you're doing your job,
Okay.
and we're doing our job, you know, to ask questions because we're legislators, that's all.
Okay,
I
so,
think Frank's had probably the best suggestion of all, because obviously this needs a county-wide solution, so, you know.
And Mayor and Mayor Fayetteville have been talking about how they can be the catalyst for that.
Okay.
Because as the chief said, we're the biggest strain on the system, and the mayor of Fayetteville feels like his department is the municipality that's.
Many of his residents work in the city of Syracuse.
I'm sorry?
I said many of his residents work in the city of
Many
Syracuse.
of the residents feel it, but their taxes are not sufficient. They can't subsidize
Sure.
our ambulance service forever. And they're not completely subsidizing it, but they're feeling the strain.
Okay, other questions? All right, well, thank you, Chief. Thank you, everyone. I think that will do it for us today.
all right,
Have a
thank
good
you for
day.
your consideration,
Thank you.
everybody.
No problem, Chief.